Welcome to Double Helix, where everything is connected. Hey there, awesome viewers and listeners. I'm your host, Mark Merritt, and on this show, we're going to dive into the fascinating web of connections that shape our health and our lives. From our physical and psychological well-being to our emotional and spiritual growth. We'll explore how these connections, whether they're with the people around us or in intricate networks within ourselves, all the way down to our DNA, and how that can transform our lives for the better. Thanks for tuning in, and don't forget to hit the subscribe button and give us a thumbs up for episodes that resonate with you. Let's get connected. Well, hello again, everybody. This is Mark with Double Helix, and I'm super excited today. I know we've talked more than once in different episodes about someone brings up Mark's accident, or we talk briefly about it. Today, we actually have two amazing people with us. The first, and I'm going to go always ladies first, is Kaylee Whitehouse Jenkins. I always knew her as Kaylee Whitehouse, but it's yes. Kaylee Whitehouse Jenkins, and then Jeff Dodd. And those of you that don't know these two amazing people, they are both individuals that took care of me in the hospital after the accident. And so today is the episode. We're going to talk a little bit about it. We'll talk about what happened beforehand a little bit. We're not going to go into gruesome details because Mark does not need more PTSD as post-accident, because if we get too details, then I find myself cold sweating in the night, and I don't want to do that.
Getting queasy, doing this.
Oh, yeah. And so welcome, Jeff and Kaylee. I'm very excited to have you guys both with you. If you could, Kaylee, start and just give a little intro about yourself. Where you're at and what you're doing, and then Jeff, you as well, and then we'll just get rolling.
I'm Kaylee. I met Mark when I was working for Intermountain Medical Center on the trauma floor, and that unit is like a post-ICU, kind of like a step-down unit between ICU and home. So we get the patients that are awake and talking, and I met him before I was married. I think it was, 2010, 2011?
2008.
Oh, my. So pretty early in my nursing career when I was a fairly new nurse, but I stayed working there for about 5 or 6 years. I learned a lot there. It was a very busy unit, so just getting my feet wet with nursing. Taught me a lot about trauma, but I kind of got burnt out on doing straight trauma all day, every day. It's a very specialized unit. So I did get married and I moved to Alaska. So I am currently in Anchorage, Alaska, and I've been here. I was on the 2-year plan. I was on the plan to go and get some experience working in the ICU up here, and then we were going to move back to Utah. But that was 2012, and I don't know if you've ever been to Alaska, but it gets in your blood and you get addicted to living in like a very, very clean, very adventurous state. So I've been here since 2012. I have 2 kids, and I am working at the ICU here at Providence Hospital in Anchorage. So I've been doing ICU that whole time, and I love it. I still do bedside. I'm part-time now, so I get up, do my shifts, but it's a very wide ICU, so we get a whole slew of specialties, and I do charge and different equipment, and pretty trained on that. So yeah.
Awesome. El Jefe.
El Jefe. Would you say La Jefe? I don't know.
No, it's L. It's L. No. We got to keep it L. Yeah.
Okay.
Well, my physical therapist assistant by trade. I've been doing that for about 20 years, and about 18 of that was in trauma services, where I met Mark. I met him on the ICU and then transferred up into the great also care of Kaylee, that she was providing. So last 2 years I've been the acute rehab manager at Intermountain Medical Center. So I've been with the company for about 20 years. Always had a passion for trauma services and patient care and making those great connections that make a difference in patients' recoveries. I am now married and I have 2 of my own kids, my wife's 2 kids, and then the 2 smartest dogs on earth are mine.
All right, I'm going to leave that one there because that's a pretty bold statement, Jeff. I'm just saying.
They're so smart.
So, yeah, let me take a second and I'll kind of give a little bit of the backstory, a high level backstory about the accident until I get to Intermountain. So those of you that don't know, and like I say, people keep bringing it up, but on April 26th of 2008, I was actually removing some trees from our property in Pleasant Grove, and I was harnessed up in. I didn't realize how high I was until the firefighters came back and told me, "Oh, by the way, we measured how high you were up." I was 40 feet up, and the chainsaw damaged the harnessing and it failed. And so I free fell to the ground and landed on my feet like I jumped. And that long story short, I think how they say it, I ended up at Intermountain Medical Center. And what I remember about there was it still had the new car smell. Because they had just opened a month or so before that. And somebody told me that I was actually one of the first major traumas that had come in. And so that was one of the vague things that I remember was it's still smelling everything brand new. Like the carpet, the smell of carpet glue and paint on the wall, all that was there, right? Mm. And so, yeah, that was, it was not a way I would recommend anyone to spend a Saturday morning because it doesn't end up well. So I think Kaylee, I can't remember, Jeff, I probably met you first, and then Kaylee when we were on the 11th floor. Mm-hmm. And but I have to tell you, the whole staff there, I can't think of anybody that I went, you know what, I didn't like that person, right? Mm-hmm. I can tell you, I'm sorry, Dr. Hilliard. I can tell you the first time I met the guy that put Humpty Dumpty back together again, which was Dr. Hilliard, and he was an orthopedic trauma surgeon. And I found out while I was there that he was ranked as like the top orthopedic trauma in the region kind of thing. And that he happened to have been on call that day of my accident. And when I first met him, and just so you know, I'm not saying anything I didn't tell him face to face. So I'm not betraying anything. When I first met him, I didn't like him. He came in the room and, this was Sunday. My accident was a Saturday. And they did the first surgery Saturday when they put all the I think they put they didn't put external fixators or whatever they had in yet, but it was more stabilizing, and a couple things like that. So they figured out what they were going to do. And I remember him coming in vaguely because those first 10 days are mostly a blur. Mm-hmm. And he's standing against the wall and he was telling us that we might have to amputate, my left leg. And he left the room and I went, I won't tell you what I said. Basically, I didn't like him. It's like, but there was no, it was, and you two worked with him. So I found out later it was his game face, right? He realized how serious it was and this is where you're at and you've got to figure this stuff out. Right. And then I remember spending time I don't know if you were there, Kaylee, when I asked the nurses to give me everything you can on above the knee amputation. So they printed off like a book off the internet so that, and I'm reading about above the knee amputations, trying to figure out, because I'm thinking, cut it off. If it's going to cause a problem, get rid of it. Right. And, I was all set until Victoria, my wife, came in the next morning, and they came in to talk to us, and I started saying, yeah, let's just be done with it. Right. Cause it was so damaged. She did not want me to have the leg. She hates it when I say the leg, because it's mine, my leg amputated. And, because she said, that's a decision you can't come back on. Right. And it doesn't get rid of the potential, because you're still going to it doesn't mean you get rid of problems. It just means you trade them. Mm-hmm. Did not to. And then I went through 5 surgeries in those first 10 days, which is why I don't remember much of the first 10 days. And I think that's, Kaylee, when we first met you, was in that process. Mm-hmm. So I'm going to ask real quick, what do you two remember about when you first came in the room? What do you remember? What, not gruesome, let's keep it clean, right? Because it wasn't pretty. But what do you remember when you first came in, and what you were seeing as from your side?
I mean, anytime anyone has fixators on, it always is kind of like, Frankenstein-esque, and we see it all the time. So what didn't really bother us, but you do get that, patient perspective where they're looking down at their own leg or their own body part, and they see these huge fixators on, and they're like steel, they're hefty, they're cranked together with, nuts and bolts and everything. So it definitely can be intimidating, and especially, in the first little bit when we're checking, tissue, we're checking the pulses so much. And then, I can imagine as a patient, it's a little worrisome when we're, in there with the Doppler and this little ultrasound trying to find the pulse, and then we can't find the pulse, and we're worried, and we bring in the charge nurse and all this stuff. So I know there's, definitely apprehension, and in that phase where you're trying to figure out, are you going to keep it? Are you not? It's a life-altering thing depending on what things look like. But, I feel like in any trauma situation with any trauma patient, we're usually the first people that go in. And to us, it's another day at work. But, these individuals who come in with these horrible accidents, their life has just been altered. And, you really have to come in with a separate set of eyes to realize, this is another day at the office for us, but for them, it's serious. And so a lot of things that maybe, are not a big deal, or to us, to them is like, check this, check this, check that. So they become hyper vigilant and hyper focused on maybe something that, is another day, but to them it's a big deal. So you have to take all those things and digest them, and kind of, I hate to say dumb it down, but just put things in like layman terms for people, and just really be good about explaining to patients, because to them, this is all. And most of these people are young, healthy individuals. These trauma patients, they are patients that, have never had anything wrong. They don't have a whole list of medical problems. They're young and healthy, and we're out cutting down trees and, on their motorcycle and all kinds of things. So, it's definitely every room that you go in, you have to have those set of eyes, like understanding where they're coming from. So I definitely saw a little fear, in addition to pain, because like definitely those things are painful. Legs, ankles, down in that area, Jeff can attest, those are some of the most painful surgeries that people have, is right where, the ankle meets, and it can be a lot of really tough work and a lot of pain. So a lot of fear, a lot of pain, and just almost like panic for a lot of patients going through stuff like that.
And then enters physical therapy and says, hey, we're going to move.
we're going to sit you up.
Guess what? We're going to grab this external bar that's holding your leg together. We're going to lift on that bar, and we're going to sit you at the side of the bed. And that's the way, when you really get the whites of the eyes.
Yeah. And by the way, you're going to pass out.
I think we had that conversation.
Which was my experience after having laid horizontal for 2 weeks. And then finally, let's sit you up. And all I remember is just sitting up. And the next thing you know, laying on my back, looking up at the ceiling, and I'm wondering, what surgery have I just come out of? Because I'd had so many of them, right? I had no clue. And I wake up and there's Jeff and there's my wife. And I'm blinking, and it took me a few seconds to realize, I guess I did pass out. Because Jeff is never there when I'm coming out of anesthesia.
Yeah. Well, I will say, if we did our job and educated well like we should, I think we probably had that conversation of this is a potential, and kind of setting the patient up to know what's in store, that this may happen, but I've got you. You're in good hands. We'll be watching all of your vital signs. We'll be doing all your orthostatics. We're going to watch your eyes and watch to see if you get diaphoretic and sweaty and all of those things. And I mean, your first time up is definitely that is a potential to happen. So we need to be prepared on our end to make sure we're doing the right things to make sure that you're safe.
So. Well, I think, the biggest thing for me from the patient aspect, right? The reason, you two hit exactly home of why. Kaylee, you were explaining here that when you walk into a room, you want to have those conversations and look at it from the eyes of them. And I think you two did such an amazing job with that here we are 18 years later, and we're still connected. Right. And in reality, Jeff, you were a little too old, but we kept wanting to adopt Kaylee. She wouldn't let us. She'd leave the room and Victoria'd go, "Oh, we so need to adopt her."
Well, she would have been the better choice. Like, even if I was the same age.
You're probably right about that one.
Yeah.
And so, it's I think from the patient standpoint, what your mindset that you two had made a huge difference for me in that healing process, right? And I think those human interaction connections, Jeff, like you were describing, you're probably going to get lightheaded. You're going to probably feel this. I remember you having that conversation with me. Mm-hmm. And, I didn't know if you were, prophesying or what, but it came true.
He's just done it once or twice before you, maybe once or twice.
Yeah. Many times. When you were talking about like the intricacies and the attentiveness of patient care, and when you were talking about Dr. Hilliard earlier, it reminded me of a conversation I had with him where he had come upon you, and you were getting ready to roll back for surgery, and you were in the bed and you were by the windows. And of course, Intermountain Medical Center has multiple levels to it. And so you were by a window, and he said that you were just sweaty and almost shaking and kind of pale. And he looked around and he realized that you may have been reliving, and I don't know if you remember this or not, but
I do.
reliving the height part of the accident. And so he unlocked the bed, he moved you away from the window, he got between you and the window and had a conversation with you. And that just goes to show the care and attention when you're paying attention to what's around you, the differences that we can make that may not seem like a big deal, but can be a huge deal.
Yeah, in that situation, I'm glad you brought that up, because in that situation, I can't blame the orderly or whoever brought me down, right? Most people are going to want to see out the window, right? Yeah. And that surgical floor is on what floor?
11.
No, the surgery floor.
I'm trying to think.
4th floor.
Oh.
And how high is 4 floors? About 40 feet. They stick me up against the windows. And I remember I was in panic attack mode. And so Dr. Hilliard read that right. And he did come by and he just wanted to check. And he did pull me away and started talking to me. And that's the moment that I thought, okay, I have not given this man his due, right? And so he did. He sat there and really just listened and distracted me so that I could calm down, because they probably would not have taken me in the OR if I would have been still feeling that way. High. Yeah, exactly. Something's way off with this guy. And so, I remember that. That was the moment that I realized there was that human side to Dr. Hilliard, away from the physician side, right? Yeah. And so, for sure, even though he was an amazing physician and surgeon, from my look at it and go, oh my gosh, right? But yeah, for him to recognize that, I didn't realize you knew that story, yeah. Jeff.
We had that conversation. Gosh, I don't know. I mean, he's not he talks to patients quite well, but he doesn't interact with staff on a personal level like that very often. So I think that's why that story stood out. I think it's the first time that he had actually shared something like that with me. And so I was like, right on, this is great. That's good. That's what we want out of all of our care, all of our caregivers, doctors, nurses, APPs, anybody.
Yeah, it was pretty rough, and you both know it was pretty rough for a while. And Kaylee, you kind of alluded to that earlier. I mean, it was our worst days, right? And you guys are there, and I remember, Dr. Hilliard. Sometimes he'd come in at like midnight to check on me, and then like a few hours later he'd be back in. I remember at one point going, when does this guy sleep? And the only reason I know he came in at midnight was because, Kaylee, you guys kept checking my damn blood pressure.
So rude. So
right.
Rude.
Well, that first, how often do you have to do blood pressures after a surgery? Right.
Oh yeah. Every 15 minutes, then every 30 minutes,
yes.
Then every hour for 2 hours, and then every 4 hours. Yeah.
Oh, and then by the way, you're going in for another surgery. And so
and then we're going to poke you and get your labs. And then by the way, we're going to wake you up again and do something else to you. We're going to check your pulse again at 1 a.m.
Oh, yes. I remember. and so I remember Hilliard coming in one day. And the thing I really liked about him and what he did from a patient standpoint is he would come in and, he'd look at the labs. And I remember him saying, okay, your blood platelets aren't high enough yet. We need to, I don't know how many transfusions I had, because I just wasn't producing blood platelets enough yet. And so he kept saying, here, have some more blood. And I hated that every bit as much as surgeries, because why? Oh, there's blood pressure every 15 minutes. It's just that whole surgery cycle all over again. But he would always sit down at the bedside. And he said it so many times that it's like ingrained in my memory. Do you have any questions or concerns for me that I can answer before I go? And if you had something, he would sit there until you were done talking. Mm-hmm. And I remember one day, I don't know if you both know that I was actually getting ready to go on an archery bear hunt with one of my brothers and my dad. Mm. And while I was in the hospital, that was the hunt. Mm. Right? And so I'm laying there in the hospital, broken up down low. And I don't know if you guys remember, but my left arm I couldn't use. Remember, it was limp at my side. And all I could think about was, I'm an archery guy and I can't hold a bow because my left arm no worky, right? It does a lot now. I can do a lot with it. I can't do dexterity stuff with it. If I go to pick something up, there's not much strength in the hand because of the nerve damage in the arm.
Was it a brachial plexus? Was it a brachial plexus injury, or I'm trying to remember?
No,
like
the
the
nerve
nerve was
damage. The nerve
stretched?
damage was in the elbow area.
Oh,
From because as I fell a little bit on my left side, that arm
mm,
was out, and so it didn't break a bone, but the nerve got damaged,
gotcha.
and so it was one of those. At first, I could use the arm when we barely first got in the hospital, but within a day or so, all of a sudden it was useless. I mean, I still remember having to grab my arm, and I would actually grab my thumb. If someone wanted my left arm, I'd grab my thumb and pick it up with my other arm, right? Because I couldn't lift the arm. It was just weird. And so I remember that one morning just sitting, just bawling to Hilliard that, here I was supposed to be on this hunt. I mean, all the world is falling because I can't hold a bow, right? Of all the things that are going on in my life, I'm upset because I can't hold a bow, right? And he sat there and just listened. I don't know how long he sat there, but he just sat there for a while. And then finally he looked at me. And of course, that's out of his scope, the social, psychological, emotional. Give him a Black & Decker drill and some screws. He's good, but get him outside of that, right? It's not his area. As he said, this really isn't in my area of expertise. Can I have someone? He did. Can I have someone
totally hear him saying that
and help? And so he sent a social where the hospital social workers in. And Victoria and I are eternally grateful that he did this, because we had spent, at least I had spent so much time focusing on what was going on with me. I hadn't noticed what was going on with Victoria. Mm-hmm. Because I don't think people they don't always realize that, hey, the loved ones in the room sometimes are in as much or more pain than, at least that's the way I looked at it, And that social worker actually helped Victoria and I be able to start having some more communication and talking, because we were both kind of closed off. At least I was into my own little world of laying in the bed, because all these really cool people were there taking care of me. And Victoria was kind of watching from the side like, right. But it's because Hilliard and you two, every time you two would come into the room, what would you do? You always engaged Victoria.
Of course, yeah.
Yeah, well, I think, it's just natural. If the caregivers aren't well, if they're not sleeping, if they're not eating, if they're so stressed, they can't function, they're not going to be any use, when you're spinning and we need a washcloth, they're going to be like checked out. So it's really important, and especially, coming from, like, the one nice thing about Intermountain Medical is family members could sleep in the bed, they could sleep on the couch, they could be in the rooms, they could be there all night if they wanted to. But I don't know what their policy is at IMC, but here we don't let people sleep in the rooms, and it's not to be rude, it's to make them go home and sleep and get good sleep. So when they come back in the morning, that's when we need them. At night, we want the patients to be sleeping, but we also want caregivers to be taken care of so they can help take care of their loved one, so they can get their battery recharged as well. So it is super important because, it's not just the patient, it's their whole, support group. So it's, their spouse, and then their family, and then their neighbors and their community, and it just branches out. But if you don't, take care of the family that's there, that's their core support.
Yeah.
Well, yeah, and I think from an education standpoint, to just kind of back up what you're saying, we really need to start family training and start family education so they know what to expect. You're not going to be in the hospital forever, and we want those transitions to be successful. So, and we want you to be prepared and know what you're up for and know what you're in for. And so one of the best things that we can do is that education, and start getting family involved in the care and your healing, and naturally that's going to be beneficial for both of you, as we saw.
Yeah, definitely. So I will transition away from one little piece here, and I have I'm debating sharing the story. Kaylee, I think I told you the story. I don't know if Jeff, I told you the story about coming out of my first surgery. And the nurse in the room, Kaylee, do you remember me saying this?
Mm-mm. Tell me. Maybe. Bring it back.
Victoria's going to go, I can't believe you told this story.
Oh, yes.
Yeah.
Yes. You said you were going to say it.
I'm going to.
Kaylee said to.
It's the power. It's the power of anesthesia. That's all I'm saying. We're gonna blame it on the anesthesia. So that was first, as I mentioned before, a couple times now. I had 5 surgeries in the first 10 days. That first surgery was like 5.5 hours long, or some, just to stabilize things. And they get me up to the room. Okay, I'm opening up on this one. And they get me up into the room, and the nurse is checking vitals. Victoria's standing right here, and the nurse is checking vitals. And, of course, they've got me hooked up in every way you can, right? They've got IVs and nasal cannulas and a catheter and the whole thing. Well, apparently the nurse was checking the catheter. And I am half in, half out. And all of a sudden, in my drugged, eyes closed stupor, I know Victoria's there. And I said, honey, somebody's playing with my winky. And as soon as that came out of my mouth, I swear it was like an alcohol. All of a sudden I had a caffeine jolt and my eyes came wide open. I'm like, did I just say that? And Victoria's totally laughing. The nurse is laughing. And to this day, I've always been like, it's just bad. Anesthesia works. That's all I'm saying. And by the way, I've never told that story. Now it's going all the way out there.
It's out there.
Your podcast is going to go viral now.
It's not going to go viral. But yeah, so the first room they had me in, I think I can't remember which side of the hospital, but the room was hot. And they kept having fans come in and blowing, and then they finally moved me the other side of the hospital. I don't remember which hallway I was on, but one was hotter than the other.
It's crazy because I can still, I know you were against that back wall, and so I know you were in room 1120 or 1121, coming around that back area. It's so crazy because that's how I know people. I'm like, oh,
you're 1120.
He's in room 19. It's so funny because that's how I, remember where people was thinking about the room they were in and stuff. I haven't worked there in 13 years, 14 years, and I still think about, which patients were in what room.
I can't believe you're going to rattle off a room number like that. It's 18 years ago. It's like, you were 1120.
I don't know. I'm pretty sure that's what room you were in.
All I can tell you is they all looked the same. The 2 rooms I was in, it was just opposite layout. That's all it was. So, well, I've been enjoying our conversation.
Me too. And it's good to see you guys in person, or at least faces,
virtually, if not, So Jeff, you got to tell us about the wall behind you. Did you paint that, or did you have someone paint that?
I did not. So I have a little recording studio in my house, and that is just it's kind of a wallpaper that is stuck up, and then I just have soundproofing everywhere for when I get to play. There, that's my therapist is music, but yeah, had to get it looking cool too, right?
Yeah, as soon as it popped up, that so fits you. That really does.
Loud, obnoxious.
Well, I wasn't going to go that far.
Kaylee was, so.
Innocent.
Oh, innocent. Oh, is that what that was? So yeah, those of you that don't know, Jeff actually is also is one of his many talents. He's also a musician. And so he does recording there in his basement, which is way, way cool.
He used to do shows. Do you still do shows?
I don't too much anymore. I'm just starting to get back into playing and relearning the material that I once upon a time wrote. So, yeah, it's been fun to get back into it. But yeah, I might get out and play again. We'll see.
Yeah, we found out in a conversation I had with Jeff a week or so ago that Victoria is his groupie.
Oh,
my one and
perfect.
Only. Now I know who it is.
Yeah, your first CD came out when I was in the hospital, if I remember right, or just before that.
Yeah, it's somewhere right in there. Yeah.
And he walked into the hospital and handed us a CD. And Victoria still has that CD. And then she's got it all on Apple Music, and then stumbled across, a couple other ones that you've done. And so she downloads all of them.
That's awesome. That is cool.
That's great. Well, thanks for the plug there. I was going to bring up that I'm going to change topics. I remember when Kaylee was getting ready to move to Alaska, and she had to learn all of the names of all of the salmons.
Yes.
So,
that's true.
Not to put you on the spot, you've been there a while. Do you still remember all of them?
Of course. King salmon, those run, April, May. They're the ones that run earliest, and they're an endangered species, so you can't really fish them out. There's the red salmon, the sockeye salmon. There's tons of those, and that's what my freezer is filled with right now. There's silver salmon. Those run in late September. There's the pink salmon, or the other name for them is the humpy, because they get this big old nasty hump on the back when they all spawn out. And then there's the dog salmon or the chum salmon, and they call it the dog salmon because those are only good enough for the musher dogs. And they're really nasty, and you don't eat those.
Wow.
So yeah, I am definitely, that's my jam, salmon fishing now.
I can tell you before I think it was the summer before the accident, I was in Alaska fishing with my brothers and my dad.
Oh, wow. I didn't think I knew that.
And we got done with, I'm in Alaska, and I got home, and we're at that point, I swear I'm looking to buy a fishing lodge in Alaska. I was like, we have got to go back there.
I'm telling you, once it gets in your blood. I have to say, though, it was kind of crazy. So I moved up in January of 2012, and, that was record-breaking snow. And I knew snow because I lived in Utah, and so, I'm used to driving in the snow. But I remember I used to get so irritated when the snow plows wouldn't come for 3 or 4 hours, and I would be like, what is this? I pay my taxes. What is this? In Alaska, it snows way more, and there are hardly any plows. And so you have to get good at driving in the snow. But I will say, I went through this training program because I had been a nurse for 5 years, but I had never done ICU. So I had to do this ICU training program, and that was about 8 months. So I went around in my very first couple weeks of patients. I had moose versus pedestrian, moose versus car, and then I had a bear attack. And the bear attack victim was intubated, so they were on the ventilator, and he had gotten attacked. The bear had scalped him, basically, and then he was covering his head like this from the bear, so then the bear chewed on his hand, so he had all these hand injuries. And then the bear took his claws and punctured his lung and clawed through, and then took his claw and split open his quad. So he had I'm sure you did. Did you ever have a wound vac, Mark? Like
Yeah.
a wound
Yeah.
vac dressing for people to have open wounds. So he had this wound vac on his leg. And I remember walking by his room and he was kind of lightly sedated. He was kind of in that fugue state where he was probably dreaming or having, replaying, like what you said, like PTSD, replaying.
The winky state?
The other one.
Maybe not that. But he was replaying the accident over and over. And I walked past his room and he was like fighting off the bear.
Oh,
like,
wow.
His dreams. And I remember just walking past and I was like, I'm not in Utah anymore. Like, this is crazy. Like, the accidents up here are definitely kind of crazy, the trauma.
Yeah, because not very many moose pedestrian accidents in Utah.
No. But the moose walk the streets up here. It's kind of nuts. They're all over. You have to pack bear spray everywhere you go.
My dad used to travel a lot in sales, and I remember one time calling him once, and I'm like, "Hey, do you have a second?" And he goes, "Well, yeah, actually, I do. I've arrived at a customer site, and there's a moose standing in the doorway. So I'm going to sit right here and wait until the moose leaves." Like, okay, well, that's a new one.
Sorry, that light was like right in my way.
Yeah. Well, in the mountains of Utah, I'm definitely more afraid of a moose than I am a cougar or a bear.
Yeah, that's true.
They're a little more common.
And we do get occasional moose attacks. Maybe it's not a moose pedestrian, but it kind of is, right? I guess if you're up in
if they're up there, yeah, they're.
Yeah. Maybe it's a human.
It's so
toss.
crazy,
it's
like
moose game.
When we were talking about, when you asked me to be on this podcast, and we were talking about connections and stuff like that. I mean, I'm sure this is why Jeff stays in trauma as well. I feel like trauma is it's just the craziest place to work because you get all the drama. We call it trauma drama because all the crazy things happen, like the crazy stories, the crazy news articles, like they did what, they did how, I mean, there's just stories for everything, but trauma is such an interesting niche of healthcare. And, it's crazy because you impact people's lives so much just by doing your normal job. But, I look back to my time at IMC and like the patients that I took care of, and, it's just crazy the amount of connections that you do make with people.
Yeah.
You and I haven't stayed in too close of contact, but like I do have patients that I took care of 18, 20 years ago that like I still keep in contact, or I still see what they're up to on Facebook, or they'll contact me just to be like, hey, how's it going, but you form these connections with these people, these intimate moments with people. And I mean, Jeff is such a likable guy. Like, I'm sure you have just hundreds of people that, remember you and stop you in the grocery store and like are just so grateful to you, because trauma is just such a crazy thing because you do latch on to your patients and vice versa, or like your patients latch onto you because you are there, like helping them get through this horrible time in their life. So I do feel like, it's crazy. I think I did get burnt out on it when it's like what you deal with all day, every day for a long, long time. But I do feel like it's just such a rewarding niche of healthcare because you meet people when they're at their worst. You get to see people go through these things and see how they deal with it, how they adapt. But it is really rewarding being in that aspect of it versus sometimes I feel like ICU, we don't get to see the progress. You don't get to see the people come back and get better and heal and, walk again. And go on to do all these amazing things with their life. You only see such a small snippet. So I do love it when people reach out to me once they're better and once they're, back doing all their stuff again and walking and competing and, having all these amazing lives, just from that one little accident that totally changes their trajectory in their life.
Yeah.
So,
I've always, I couldn't agree more. I think that it is just such a gift to be allowed into somebody who's maybe having the worst moments of their life, and you get to be a part of that healing process. I mean, like it is so rewarding, and it's hard, and oftentimes you do end up taking home things from your patients, but like what you bring to the table to help in their healing process is just such an amazing gift, and I've always loved that. It's what kept me in trauma as long as I did. I remember actually one of my favorite things to do with when I had students is quiz the students. And like when they would come out of a room, they'd be like, yeah, I'd say, so tell me about your patient. And they'd be like, that's so-and-so. And they had like a broken back and a broken leg. And they can't put weight on that leg and all of that stuff. And they go into all the medical stuff. And I'll wait for them. And I'm like, cool. So now tell me about your patient. Like, what's your connection with the patient? Because your treatment as a clinician is going to be exponentially better if you have a connection, if you have a purpose, if you have a reason and a why, and understanding of what is meaningful to that patient as you move forward to try and help them heal.
What I think is really interesting, and I couldn't agree with you more on that, Jeff. What I think is interesting is somehow Jeff knew, just by, knowing his audience, which was me, in that process of my healing. What did you do, Jeff, after I left the hospital?
I probably
You used to call me.
Yeah.
and have me do what?
So you were inspirational into other patients that had injuries post your recovery, and you would come and talk to patients that were having a hard time perceiving of how they move forward. And it's one thing, like I can say how you're going to move forward, but like it doesn't feel as real as when somebody that has experienced it and gone through it, and then you see where they are and what they've done and the achievements that they've made, like what you would do. It was way more real coming from you than it was coming from me. And yes, I resourced you as much as I could, and I loved it.
That's so cool. I didn't know that. Was that like at the hospital or just like people in an outpatient setting?
No, it was at the hospital. I'd get a call from Jeff. Hey, can you come up? We've got a patient that I think you would really connect with. And I would go up to the hospital and spend a little time with the patient.
That's so cool.
And it not only helped, I'm hoping it helped them, but it also helped me as well, right? He may have been using me as a resource, but it really did help me, because instead of being on the just the receiving end or the taking end of all of the kindness and care, I actually got to be able to, because Jeff opened that opportunity to be able to go and share, and got to meet several really, really cool people in that process.
That's awesome.
Yeah. It was very, very, very helpful. So,
I love that.
Yeah, we even had a recent conversation of me trying to lure you back to talk to my team, just because sometimes I think we lose focus on what's important, and the important part is the patient care we provide. And I think having these beautiful reminders of and like Kaylee said, a lot of times we don't see patients after they discharge from the hospital. We think about them, we wonder how they're doing, but unless by chance we run into them somewhere, we don't know. So the fact that we've kind of kept some open communication between us has been great, and I appreciate that. And it was Mark that reached out recently, so thank you.
Well, and in reality, I'm going to give credit where credit is due. As we were talking about the podcast stuff, Victoria and I told her I was going to do something about the accident. She specifically said, you need to find where Kaylee is, and you've got to have Jeff on with you as well. And I'm like, I can do those things. I can find anybody's stuff most of the time. So
Perfect.
But yeah, Jeff, I'm totally happy to come down and
yeah, that'd be great
to meet your staff and talk with them.
Yeah. I'll say the other thing that helps caregivers like Kaylee and myself was the relationships that we had as caregivers, trying to keep it fun, because it is such a heavy environment. And Kaylee, although not as funny as me, could be still still was an amazing nurse.
She was,
she had
to been great to work with. Yeah.
Oh yeah.
Well, it is so fun. Like,
Yeah.
and I remember, I'm trying to remember which patient it was, but like Jeff had the like ability to, if there was someone in the ICU that had been in there for weeks, like just really, really bad, was really delirious, was really like, we call it like encephalopathic, where their liver is like messed up from the shock of the trauma, and like they're just kind of out to lunch for a little bit. Jeff had the ability to connect with these people and just like make them laugh. Like, and that's so true. I mean, humor is such a big part of it too. Like, as far as having a good attitude and having humor, I use humor on the daily at work, and it's so important. Like,
It is.
it does help you heal. If you're laughing, if you're like trying to make the best of those, situations, if you have a goal of like to try and make them laugh or try and have a good time, it's helping them too. It's distracting them from pain. It's distracting them from, the gravity of their whole life, being flipped around and stuff. We have a friend, Beth, who's an OT, and I remember we were working together, and she would make it her mission. She would like make it her goal to make this patient laugh. That was her goal, because she would have like, sometimes she'd get these really crotchety, cranky people. They didn't want to work with therapy. They were refusing this and that, and that was Beth's goal, was to like make so-and-so laugh.
I'm going to wear you down.
Yep. But it was, I mean, it's all in good fun, but like, it's so true. I mean, you do see people on their worst days, but also you want to help them. And it's important, everybody has their own choice if they want to be there, if they want to get better, if they want to participate in therapies and taking their meds and doing their wound changes and all this stuff. At the end of the day, you don't want to beg someone, please let me do this, please let me do that. Everybody has a choice. But I do feel like, I've been a nurse for quite a while, and seeing everybody's like attitudes on how they get people to do things. And there's probably not a patient that Jeff could not work with, that he could not like schmooze to get them to like do their therapy.
Oh, there was.
Oh. Well, that is very rare.
What I love is he automatically went, I can think of one.
Oh no.
Maybe. But it is so true. I mean, you do have to have that personality where it's like, you have to be a good communicator. You have to be compassionate. You have to find a way, that balance of, being kind, but then also being tough, to be like, hey, we need to do these things, and finding a way individualized to each person on how, you accomplish the common goal, which is to get them out of the hospital and like get them back to their normal life.
Yeah. Well, I have to tell you, I have loved seeing both of you again. And I agree early on, neither one of you has changed. And while Jeff's the bald is still there, and it is beautiful. I'm just saying, it's a glorious shiny dome you've got there. But Kaylee, you haven't changed either.
Well, thank you.
And you don't have the bald head to hide behind.
No.
So, right. And so, which we're grateful for. I'm going to be honest. You've got the nice golden locks.
Thank you. And you're still going to adopt me.
Oh, absolutely. Yeah.
I have 2 kids now. Is that okay?
No. That's not a problem. Bring it on. Bring it on. So, but you two made such a huge difference. And I know there were others at the hospital. I know there were others that took care of me and take care of a lot of patients, right? I'm just one in thousands that between the two of you that have dealt with over the years. And so I know there's many others that have benefited from your care and the other members of the staff, right? Because I don't remember one staff member that I didn't like, right? That wasn't kind there on the 11th floor, right? Whatever chemistry they used to put all you folks together that were up there. I mean, it was a really good group of people.
It was.
And that made it easy from a patient standpoint, for healing. I noticed that, you talk about how all those factors of the humor and the interaction with the team and stuff like that helps with the healing, and it does. I was an idiot and I insisted on going home, and I pushed so hard to go home. I think they finally just said, "Get out of here. We're done with you." And that actually made it really hard at home because we didn't have the support team like you guys. I should have stayed a lot longer to finish the healing process instead of going home to try and finish that. But I'll just tell you right now, I am eternally grateful to both of you.
Thank you. Thank you for saying that.
Yeah. You two made a huge difference for me and for Victoria. We've had long conversations about that, especially since we talked about doing this episode. And I had no intention of getting teary-eyed, but Victoria will roll her eyes because she married the biggest baby on the planet. I'll watch some stupid movie and cry. So, it's just us. Oh, you're the same way, Jeff?
Yeah.
I've seen Jeff.
We were watching some movie the other day, and I just had one scene that was maybe a little emotional, and Victoria looks over at me and she starts laughing because I am like over there going, "It's all right. It's okay."
Nothing wrong with that. Nothing wrong with that.
My wife's a social worker, and she makes fun of me when I cry at movies too. So, but she's a good social worker, just not maybe as supportive as she could be when I'm crying like a baby.
Sorry, sweetie. So, thank you both very much. I appreciate you coming on and spending some time today. And once again, we love you both. And Kaylee, if you ever get down to Utah,
I do.
Then you need to holler at us because we would love all of us to connect, right?
Absolutely.
Yeah, that would be so much fun because we've got to meet our adopted daughter and the adopted grandkids, right?
We're going to stay away from the hospital, though. We will not meet them.
Oh, no. I'll go to the hospital to help Jeff out, but we'll stay away from there as our group, okay?
Yeah.
So
you pick the place, I'll drive to it. I would love to see you and meet your beautiful family.
Yeah. So, all right. Well, thank you, Jeff and Kaylee, for spending. We've been on about an hour, so thank you so much for taking your time, and thank you everybody for tuning in. And if you're my brother Marshall, there you go. Now you've heard an extra one. I guess we'll share more stuff on you guys this year. So, thank you again, and everyone, please remember that to thank these people like Jeff and Kaylee for what they do, because, our lives, every one of us has been affected or touched by someone like yourselves. And so thank you very much. And thanks for tuning in to Double Helix, and we will see you again soon.